Well, hello everybody. Thank you so much for joining us today when we're going to be talking about mental health in the workplace and the law. We're also going to talk about ISO 45003 and actions you can take. If we can move on, please. I'm just going to talk a little bit about housekeeping before we get going. It is a listen-only webinar and it is being recorded, but we want it to interactive. Please submit questions via the Q&A function, and at the end of the session, after the 3 presentations, we will address as many questions as we possibly can. But don't wait to the end to submit them. Submit them as you go, and if it's appropriate, we will answer them during the relevant presentation if it relates to something we have just said. If you experience technical difficulties, please again use the Q&A function. We do have a team on standby to try and help you. At the end of the webinar, you will receive a feedback survey. If you could fill that out for us, we really appreciate your feedback so we can keep improving what we're giving you, make sure we're doing the right thing for you. And BSI will send a link to the recording of this webinar, and you'll also get the presentations. It's a CPD recognised event, so do please request a certificate via the feedback survey if that is something you would like. Thank you. So I would like to introduce you to our panellists today. I'm Sally Swingewood. I'm a Lead Standards Development Manager for BSI, and I'm also the ISO Committee Manager for the Occupational Health and Safety Management Committee, which developed ISO 45003. And it is in that role that I will be speaking to you today. And David, would you like to introduce yourself?
Yes, thank you, Sally. So yeah, I'm a partner at Robinson Ralph Solicitors. We specialise in employment law. We're based in Leeds, but have clients all over the UK, ranging from owner-managed businesses to large PLCs with sophisticated HR departments. By sophisticated, I mean professionally. They don't have to go to the opera. We don't really have any preference there. I've been an employment solicitor since 2008. Been doing employment law since 2004. We support employers with all aspects of employment law and HR support, including equality and diversity. Try and take a straightforward approach, bring some humanity to it. We can be Lawbot 101s if required, but we prefer not to be.
Brilliant. Thank you, David. So do send your questions in on the law. That's why David's here. He's here to help you. Peter, would you like to introduce yourself?
Yeah, thank you very much. Peter Kelly, Senior Psychologist in the Health and Safety Executive, and I was part of the expert review group for ISO 45003. I am predominantly working in the fields of mental health, work-related stress and well-being, but I'm also a specialist inspector and look at human error, human accidents as part of my role.
Thanks very much, Peter, and we're looking forward to hearing more from both of you very shortly. But we are going to begin today just having a look at ISO 45003, the first standard on psychological health, safety and well-being at work. I'd like to give you a little bit of an introduction for those of you who don't know it and just talk about some of the guidance that's contained within it. So let's begin by looking at why it's important. There's some statistics on this slide, and I know Peter's got more statistics for you. I apologise if there's too many numbers involved. But the bottom line is psychological health, safety, well-being is absolutely fundamentally important to every business. Over half of working days lost in 2019 to 2020, so pre-pandemic, were due to stress, depression or anxiety, and that's the HSE's figures. Deloitte have found that mental health problems at work cost the UK economy up to £56 billion a year. That's a huge amount of money. And across the world, we're talking $1 trillion. This is a subject that was beginning to get more precedence before the pandemic, but perhaps not in the full way that it needed to be dealt with. Sometimes it was a little bit of a, oh, well, this is a nice to have. It's not. I think the fact that WHO ILO figure of 745,000 people died from overwork in 2016. Stroke, heart disease. We forget sometimes that ill health, psychological ill health, has a physical effect as well. If we can go on, please. So new figures, more figures. 28% of UK employees left their job last year, or they plan to leave this year, and 61% of them say it's due to more poor mental health. Now, we have a mental health crisis generally in society. We're in a period of huge change, huge challenge, huge uncertainty, so many things coming at us. But we can do something about mental health at work. We can create safe, nurturing spaces if we choose to do so, if we're willing to take some action, which will help all of us deal better with the stresses and strains and anxieties of the bigger picture, life outside of work. If we can go on, please. So, I said before, tackling psychological health and wellbeing at work, it's not a nice to have, it's absolutely fundamental to your business's success. If you want to thrive long term, you have to put this at the heart of everything you're doing and start building a psychologically safe culture, a trusting culture, a place where people feel they can talk about their psychological health in exactly the same way they would talk about their physical health. And of course, top bullet point on this slide, the purpose of this webinar today, it's a legal requirement. You have an obligation to look after your workers' psychological health and well-being. And if you do that right, it's going to save you money. It's going to boost productivity. And it's also going to mean that you don't have to spend as much time recruiting. People leave usually not for a better salary, but because they're unhappy where they are for some reason. So if you create a safe, happy, healthy, compassionate culture, you're going to get less staff turnover. And in an age where we are all more aware, we are more vocal, we have social media, looking after psychological health and well-being at work is going to protect you from reputational damage. People are not afraid to say that company I worked for was toxic. It made me ill. It made other people ill. It did not take this seriously. If people do that a lot, your reputation is going to go. If we can go on, please. So, how can ISO 45003 help? Well, it's a practical document. It's got practical information in it, it's got recommendations in it, and it's written in easy to understand language. Might not be perfect for native English speakers here in the UK, because it is written to make sure it can be translated into any other language as well. And that sometimes means the sentences are a little bit harder than we would like, but it is suitable for everybody. It's not just for people who are psychologists like Peter. It's for anybody in the organisation to read, every manager, HR professionals, OH&S professionals, but just ordinary everyday employees, whatever their job, you can read it too, because it will help empower you. Perhaps give voice when you don't know why you're feeling the way you do or what you can do about it. This will help educate you. So it focuses on organisational change, not individual intervention. We hear a lot about personal resilience, mindfulness, that kind of thing. And this standard recognises that that's all very well, but there's usually an organisational issue if people are suffering from ill health psychologically. It's suitable for all sizes and all types of organisations. The advice in there is generic. Not everything will apply to every organisation, but some of it will apply to all organisations. Some of you may be using ISO 45001, the Occupational Health and Safety Management System standard, and it is written to mirror that standard. It's psychological health and safety, mental health is part of what you should be looking after as part of your health and safety management system. But 45001 doesn't go into a lot of detail. So this is the detail that organizations need, because people find it difficult. They don't really know how to tackle it. But what's important also to point out is you don't have to be using 45001. Any organization at any stage, regardless of whether they've got a formal management system or not, can get benefit from 45003. It includes lots of examples to help you better grasp what this means, where you can do something about it. It gives examples of the signs and symptoms of negative impact, so you can start to recognize it in your colleagues, in your peers, in your employees. If we can go on, please. So this slide, I'm not going to read it all out, and it's probably a bit small for some of you to read, but the standard does detail examples of where hazards come from, where they arise, and they're roughly divided into 3 areas: how work is organised, social factors, and the work environment itself. So lots of things that we're all familiar with. Work overload, one of the biggest problems for so many companies. Work overload, that is an organizational issue. That needs looking at, changing this culture of doing 80-hour weeks. You know, you're a great employer because you're always here very early and leave very late and you never take any leave. It's not good for your organization in the long run. That is something that has to come from the top, that change. But there's also things like lack of control in your job. That leads to anxiety and stress. Lack of collaboration on decisions. One of the big things about ISO 45001 and ISO 45003 is the emphasis on participation and consultation of workers. And that means everyone. Don't make decisions and land them on people without talking to them first and listening to them. The people closest to the work often know better than the people right at the top of the organisation what the real problems are in terms of psychological health and safety. You may have an idea of what it is, but without that consultation, you might not quite get it right. You might be tackling things that aren't actually a big issue, whereas there's some really glaring big issues that should be tackled. So do involve people and do listen. Encourage people. It's going to take some time if your culture is, I don't know, one of long hours, for example. People may be scared to speak up about that. But we will be finding a difference with younger people in the workforce who are much less worried about talking out, and they can help drive this change, which is really, really great. You know, it's really important. But we've got a different kind of workforce coming through now. They're not looking for lifetime careers with one organisation. They do not mind speaking out when they need to. And this is something we all need to do. So the other thing that often gets overlooked in psychological health, safety and well-being is the importance of the work environment itself, equipment, what you're being asked to do. It's not just that, you know, work overload, long hours, shift work, working far from home, or having a bad manager or a manager who's really stressed and who passes it on. Cultures where violence, bullying, discrimination are allowed to exist. Those are things that perhaps more of us are aware of. But we need to also understand the importance of the actual physical environment we're working in. You can see from my camera, I'm working from home. I've been working from home pretty much continuously since the pandemic. For me, this works. I have enough space. It's not loud. I'm not overcrowded. For other people, this has been a very stressful thing to have to do. But the same goes if you're, for example, an electrician crawling into tight spaces These things cause stress. So we've got to look at the work environments we're in as well. We need to actually manage those things, give more breaks, for example, enforce more breaks, give people the chance to stand up, move around, stretch. Very hot temperatures. What are we going to do about that? Because people do get anxious and, you know, it becomes unbearable mentally to put up with poor conditions. And it's the same with lack of resources or faulty equipment that doesn't get mended when it should do. All of these things add to our psychological issues if they're not dealt with and acknowledged and taken seriously. If we can go on, please. So I said the standard does give examples of signs and symptoms of ill health, psychological ill health, and some of them are described here on the screen. So changes in behaviour, really simple. Is somebody just not what they used to be? Is a previously vocal, happy, engaged member of staff gone quiet? Have they stopped volunteering for things? Have they stopped asking questions or engaging in meetings? That is a sign that something is wrong. There's other signs like refusing offers of help when people are clearly overloaded, when they're struggling and they still say, no, it'll be fine. I'll do it myself. Yes, I'll cope. And neglecting their own well-being needs, not taking lunch breaks, not going home at a reasonable hour and getting the rest and social time that we all need. We're social creatures. So if there's no time to do that because work is overwhelming you, we're going to have issues. We're going to get ill. Reduced energy, sluggishness at work. Somebody who used to work, you know, effectively at the kind of rate you would expect and is suddenly slow. Something's going on. We need to find out why. What's causing that? We've got a real issue in this country with presenteeism, people feeling they have to come to work. And this is very much related to not having a culture where we feel it's okay to talk about our mental health. But if people are coming to work when they are unfit for work, that's not doing your business any good. So we need to really make it normal to say, actually, I don't think I can work today because I'm tired, my brain's tired, or I'm feeling depressed, I'm low about something. And it might not be a work thing, it might be external, but it's still going to affect work. We can't just say, well, that's nothing to do with us, leave your problems at the door, which is what we've heard in the past many, many times. But we can't. We're human beings. We take ourselves with us wherever we go. So support staff who are going through a hard time, and you'll get it back 1,000% in terms of loyalty and enthusiasm for their job if you support people through the hard times. Let's go on, please. So what can you do? Lots and lots of things you can do, and they don't all cost lots of money or take lots of time. As I said, involve people in decision making. Don't just fly at an initiative which says, oh, everybody has to block out 12 p.m. till 1 p.m. for a lunch break. Might not work for some jobs, for some roles, might work for some others, but that kind of thing of just telling people what to do, you're disempowering them. And empowerment is one of the things that leads to better psychological health. So involve people, make the decisions together, and then whatever rules or guidance you put in place in your organization, more people will follow it. It's really important to have ownership over this stuff if you want people to do it. So that's one good way of doing it. I've already mentioned that it's really important that we make it normal to speak out. So if you suspect something's going on, speak out. If you're not feeling great mentally, speak out. Tell people, make it normal. Say, I'm having a bad day. I'm not sure I'm going to be great today. And if leaders do that, people beneath them will do it too. One of the things that does get forgotten is that all of our personal characteristics have an impact in our psychological health and well-being. So age, gender, ethnicity, religion, literacy skills, and our personal circumstances, everything that makes us individual is affecting us. So some of us will soak up lots of stress and say nothing, and we won't break yet. We will eventually if it doesn't dissipate. Other people may be affected much more quickly or much more dramatically by something. Neither one is right or wrong. It's just different responses. So a global approach to everything won't work. We have to listen to individuals and we have to take their needs seriously, not put them down. Just because only 2 people out of 1,000 are having an issue with something doesn't mean it's not an issue. There are things that you can do. So work as a team, collaborate with each other, and make every single person in your organization feel valued. Recognize their achievements, reward them, and make it fair. Don't let people see that the CEO's got a 500 grand bonus while you're refusing to go above minimum wage for some of your workers. You're going to have an unhappy workforce. Make it feel fair. We can't, I guess, in organisations pay everybody £100,000 regardless of their role, but we can make it fairer than it often feels in some organisation. So remember that you need everybody that you employ. You need your cleaners, you need your canteen staff, you need your maintenance workers, you need your business executives, you need all of them. And just because one person has a more senior role, more level of responsibility, doesn't mean that the other people are expendable. So recognise and reward, and take action on the root causes. More than anything else, look for the root causes of your problems and deal with them at an organisational level. Don't just react after something bad happens, after somebody goes off sick with stress, for example, or a team has disintegrated and has started fighting and not meeting deadlines and not being productive. Start early, intervene early, and just aim for little improvements, incremental improvements. You're not going to get it perfect, and it doesn't all have to be done straight away, but take action, take visible action that is meaningful, because your workers have told you that's where you want to intervene. If we can go on, please. So anybody can read this standard for free on the ISO website, and there is a link in these slides that will be sent out to you. If you want to download it, you can buy it from the BSI shop. But read it, please read it. It will help you, and it's going to help you meet those legal obligations that we're going to hear more about in a moment. Do get in touch with me. Feel free to ask any questions you like. I'm always happy to answer questions on the standard and how it can help. But now I'm going to pass over to Peter, who's going to tell us a little bit more about the regulatory framework. Over to you, Peter.
Thank you very much. So yeah, we're going to look at the regulatory framework for promoting mental health in the workplace. But before we do that, if we go to the next slide, I want to take you for a short trip to really contextualize where we find ourselves. I've entitled it "In the Eye of the Storm: Mental Health Post-Pandemic, the Role of Regulations and the Law." I want you to consider that the boat that you see in front of you is representation of the pandemic. The individuals in it, which would be George Clooney amongst others, is the global recession, and then behind it, however, is this massive tidal wave. And what we do know is mental health is hugely impacted by pandemics and by recessions. But 100 years ago was the first time we had both of those together. Can you now move to the next slide, please? And we know this because from the data from 1918 showed that there was 2 major events afterwards: the Great Depression and a huge increase in cases of mental ill health across the world. And we've had to learn from that, and hopefully we are now in a better place than we were when we were in 1918, if we do something about it. Next slides, please. I want to use this really to illustrate what's sort of going on in terms of people's mental health, and how mental illness has sort of been a bedfellow of the pandemic. looking at the first wave, because we're all familiar with that now, you see here a graph that has two reaction curves and an adapted element. This was shared with me by an SAS, a Special Forces captain from the Swedish Special Forces. This is actually a manual that they use to chart soldiers' psychological distress when they're going into conflict zones. But we were talking about how actually what we were seeing in the first wave of the pandemic was a gradual increase, as you can see by the line that goes up through the yellow curve, in people's perception of their mental health being impacted. Because obviously we were only going to go into this for a month, or it's just a flu. So a lot of these things that are characteristic of people's beliefs meant that it was a very slow turn in terms of people's mental health. When we get to the top of the curve, this is the start of the lockdown, and at that point people adapt. And the important thing to note is that as we come out of each of those curves and each of those waves, the right hand line shows you quite clearly a marked increase in people's mental distress straight away. So people returning to work, people going back in on the trains, on buses, trains and buses, and then eventually planes. And what we've seen in wave 2, 3, and 4 is not the left, but the right. So we have now seen mental psychological reactions to the pandemic. We've got life-changing times in some people's lives. We have 16-year-old apprentices coming to work displaying reactive depression and anxiety, and in some cases, symptoms consistent with PTSD. So these are kids who didn't feel able to get through the pandemic and weren't necessarily supported. We've got a range of ages showing it. So the point is, we can pretty clearly state and see, we know where the mental illness is coming, and characteristically it is there. Next slide, please. And during that, you pass into all the various other elements that went into being in lockdown. Uncertainty about future roles, uncertainty due to the global recession, economic downturn, vaccines, what does it mean, social distancing, and lots of unknowns. So the pandemic really highlighted to us how fragile most of our economies and our work practices are, because we were basing them on an old way of working, which leads me to the next slide. We are now finding, well, people want a normal life, or what is a normal life? So it's an interesting concept, isn't it? A normal life might mean that you want to be part of the Great Resignation and move into a job that you want to do. A normal life could be that you want to do something entirely different, or it might be actually I want to be in hybrid working. So the rules that governed how we work have been completely turned upside down. The narrative on work has changed, and subsequently we've seen a large increase, which I'll come to shortly. One of the reasons we as a regulator are involved is we cannot afford not to be involved anymore. And we have been involved, but we are very, very, very much going to be involved over the next 10 years through the new strategy in stress and mental health. Next slide, please. And I want you to have a look at this slide in front of you and look at the date. So 2019, we had 600,000 people off with work-related stress, depression and anxiety. That was equated to 15.4 million days lost to work-related stress. This is 2019. 2020, 1 week into the pandemic, because that's when our collection of data stopped, we had 828,000 people off and 17.8 million days lost to work-related stress. Before the pandemic, we had a crisis. After the pandemic, given that we know, based on the World Health Organization, 25% increase in depression and anxiety, those numbers will increase. We could realistically be looking at 1 million days, 1 million people off, and 20 million days lost to work-related stress the next time that the numbers come out. So anyone says it's down to the pandemic is blatantly untrue. We had a problem before, and we still have a problem now. Next slide, please. So what is the law around health and work-related stress? Well, for us, the prevention is key. Employers, first of all, have a legal responsibility under the Health and Safety at Work Act 1974, Section 2 of the Act, to protect people's health and safety. We didn't write into the Act just their physical health. The Act is all health and safety, and that you should protect your workers from exposure to those things that make it possible for them to experience ill health. Work-related stress, depression and anxiety is ill health. Work practices that create that ill health are hazards in the workplace that need to be managed. ISO 45003 has that at the heart of it, which is, what is the hazards, how are you managing them, and what have you put in place to for those who are suffering from stress, depression and anxiety. The management of Health and Safety at Work Reg 1999 ensures that health, safety and welfare at work of their employees. Under that, Reg 3 requires you to do a risk assessment for exposure to practices and work that cause ill health and lead to accidents and safety related behaviour. It doesn't say, again, it's just physical health, musculoskeletal disorders. The duty is there, it is embedded in the regulations. So you are required to do a risk assessment. If you do a staff survey and you find out you've got people that aren't happy and you don't do anything about it, then that's your argument for reasonable foreseeability that's gone. Okay, so people say I do a staff survey and I say, well, what have you done with it? And the important thing here is it's not good enough not to just do a staff survey and find out the nice things about you. A staff survey effectively becomes part of that communication. It tells you you've got a problem. You probably will know you've got a problem anyway. When you look at Reg 5, you've identified through your risk assessment you have an issue. Reg 5 requires you put a management system in to manage that risk. Okay, we're all familiar with, some of us are familiar with 45,001, the health, a sort of safety management system that was there. 45,003 would allow you to argue reasonably with an inspector that you put in place a practice, that you're doing something to manage that risk, because it takes you through the requirements of what need to be there. So, but traditionally in the cases and the notices that I've issued, it has been Reg 2, so it's been Section 2, Reg 3, or Section 2 and Reg 5. And if you are found not to have done a risk assessment, then you are required to do Reg 5 as a consequence of doing that risk assessment. So the law is pretty clear and we will use it. I've used it recently, and in the right circumstances, we will seek to use the Act and the regs to bring about change. Next slide, please. So these are the management standards. These were developed back in 2004, and traditionally we looked at work-related stresses from demands, control, support, relationship, role and change. Okay, so high demands, low control, low support is the most common denominator in most work-related stress cases. It is mitigated by relationships, being good and bad relationships, supervisor and non-supervisor relationships, about being clear of your role or not clear of your role, and about a change program where you've actually been through, and which is a positive one or a negative change program. Think about the context of the global pandemic. What is the one element of those six areas that was predominant, that stood out? Was control. The pandemic took away control. Subsequently, what we found is that people weren't supported like they used to be, because all of our systems were based around face-to-face contact and not really about Zoom and about team and about how we actually engage people when you can't physically see them. Relationships were massively strained. People, going out and to try and find contacts with people. We had situations like, I mean, I live on my own. Some of you will know from my previous webinar that I adopted a couple of bears and a squirrel. And I fed them, you know, and actually I needed some connection with the world outside. And our roles changed overnight. You can't ever work from home. Oh, now you can. On Monday you couldn't, on Tuesday you could. And we've just been through the biggest change program in source since we know, since we've sort of been collecting data, and actually it was unbiased. So next slide, please. The management standards is the 5 steps of risk assessment. It's also built into the 45,003. It's the principle of continuous improvement and prevention as the starting point, not as the end point. We expect people to do this, to do the 5 steps. So it's based around the risk assessment process, but it takes you through the 5 steps of that, and you know they're very, very similar to what you'd have in any other physical risk. Next slide, please. And ultimately, what you're looking at is the journey to workplace mental health involves 3 elements. One, you want to prevent work-related problems or work-related stress occurring. So that prevention should be the goal of what you're trying to do. You want to support those people that've got mental ill health and stress because they've gone down that line and they've shifted. But ultimately, if you promote good working practices in mental health, you will get an impact on prevention and an impact on support. So the journeys of mental health it's got 3 elements, but if you think of it as an overarching element, prevention is on the left, support's on the right, and promotion is in the middle. So we have to promote healthy work practices so that it gives people the ability to have their mental health managed. Next slide, please. So one of the things we've done recently is the Working Minds campaign, because people said, well, we don't know how to talk to people, we don't know how to address stress and mental health. So we did this campaign. It will run for 2 years. Next slide, please. What we're trying to do is to get people to make it routine, to reach out, recognize, respond, and reflect. So when reaching out, it's asking the question how people are, where they're at. It's not saying, are you okay? And they go, I'm fine. It's being creative in the language that you use to get people to talk about mental health. It's starting the conversation. Next slide, please. It's recognizing that actually demands, control, support, relationship, role, and change are all characteristics of work. If they're not managed in work, they're likely to produce a response both at an individual level, as we can see, mood swings being withdrawn, increased emotional reactions, but also at a team level, we see more complaints and arguments, sickness, absence, breakdown of communications, etc. If you're managing the demands of your workforce by giving them control and by supporting them, you're going to begin to be reducing the probability of people going off ill. Next slide, please. And if you do look at what your issues are, you need to respond to them. Don't simply do a staff survey and ignore it, or don't do a stress risk assessment and ignore it. You've got to respond to the issues that have been raised. Remember this, you're required under health and safety law to do the risk assessment, so you might as well do it and show us how you've responded. And you need to work together to create action points to prevent support. If you have a culture, as Sally said, of high demand and excessive demand, you have to reduce that. We are humans, we have certain capabilities and functions. We often develop systems and processes that override that, and that's where we get this issue, where people feel overwhelmed. There is a brilliant switch thing that was designed on this Apple phone. It's called switch off, and it's 12 seconds from freedom. How we interact with technology, how we interact with systems has to change. The pandemic clearly showed us that the systems weren't that adaptable. They have to be adaptable. This is the once in 100-year event, but there will be other pandemics and there will be other recessions, and we've got to get better at managing workplaces and changing the narrative of wait until you're ill, but intervention. Next slide, please. And once you've done asking your people what it is, you need to reflect on the things that you're putting in place. And once you Once you put those things in place, you need to make sure that they're working. If they're not working, change them, put something else in place, but always consult your employees in the process. Next slide, please. And once you've reflected and you've gone through the reaching out and the recognizing and responding, make it routine to have conversations with people. Make it routine to ask and assess what's happening in the workforce. Make it routine to do the things that we are expecting you to do as employers, and that is to risk assess. That is to change working practices that cause ill health, and to promote a culture where people's health is improved or sustained in work and not made worse. Next slide, please. But I'm only a couple of slides off to finish here, but the real changes for me happen when we do this. Next slide, please. We reach out and we support each other in both in the way we work and our own mental health. And I share this discussion I had with the Royal College of Nurses at their conference. And I said, do you know what, for 8 weeks, Peter, people laughed, clap. People said to us, you know, you're amazing, you're this during the pandemic. But once that 8 weeks was over, no one then asked them, how are they? How are things going? Where are they at? You see, we showed a degree of reaching out and supporting people during the pandemic, and it worked, but we need to carry it on. It needs to be a norm that we support each other through difficult times. You want to know how to change the way you work, you've got to work with your people to do that. And you've got to trust your people to generate solutions for you. And so being able to reach out and support is really important. Next slide, please. And ultimately, what we've seen there is compassion, isn't it? And actually, if we're compassionate in work, then many of these things will come about. It is an anomaly why you cannot do the same things you do at home in work. For me, why cannot you ask if you're at home and your child's upset or unhappy? You ask what's going on. Try and get to understand what the issues are. But we come to work and we say we can't do that. Well, why can't we do it? And this is one of the things that the 45,003 has done was to ask, is to give you examples of the kind of things you can do to start tackling the why questions. And in that is actually getting people to talk about their own mental health. Next slide, please. And ultimately, what we're trying to do is put the heart back into health and safety. I did a talk with Louise Hoskins, president of IOS, 2 days ago, and we talked about how it was important to manage people's sense of psychological safety and health in improving their overall sort of well-being, but also the fact that good health and safety isn't just about the mitigation of physical risk; it's also about the support of people through the psychological strains that occur because of poorly managed work. Next slide, please. And this is the last slide, but I want you to have a look at this picture, this drawing. This is a drawing done by a Chinese artist, and it was in the first week of the lockdown in Wuhan. And what are they doing here? These nurses, they're reaching out, they're connecting, right? Supporting each other. They're showing compassion and they're showing empathy, and they're putting their heart back into health and safety. And that is my last slide, and I will hand over to David now to give you the lawyer bit.
Thank you very much, Peter. Thank you, Sally, as well. I obviously preceded you. I'm hoping that was red paint on that image of the hands there. Can't quite get that picture out of my mind, but I'm going to work on the basis it was red paint. Okay, so
it wasn't blood. That would be a definite no.
Good. That's reassuring. Should we move on to the first slide, David? I'm not talking to myself, by the way. There's another David controlling the slides. The CIPD, which is the Chartered Institute of Personnel and Development, have reported that mental health has been increasingly prevalent as a cause of both short-term and long-term illness. and has remained one of the most common causes of long-term absence. Now, that report was just before the pandemic, and no doubt it has increased since then. The same report also confirmed the rising culture of presenteeism was potentially even more harmful than sickness absence, as presenteeism could be masking more deep-seated organisational issues that could be undermining health and well-being at work, for example, unmanageable workloads, and that's been, as Sally mentioned, identified as a huge cause of stress. Whilst employers can introduce exemplary well-being policies and make a serious investment in employee health, those aren't going to have any real significant impact unless people are managed well in the workplace, with there being a supportive and inclusive culture, and arguably most importantly, a leadership that is committed to pushing through change and to supporting employees in that respect. And that's so often the case with so many initiatives. It's so easy to have a policy, and as an employment lawyer working with HR professionals, sometimes policies are criticised, but I think they are criticised because there is a perception that they are pieces of paper that sit on a dusty shelf and don't get used or referred to. But if a policy actually reflects the way that a business is going to operate and what it's going to do, then it will be important and will have the effect. But as I say, that needs to come from the top. Now, the NHS defines mental health as a positive state of mind and body, feeling safe and able to cope with a sense of connection with people, communities, and the wider environment. I think that reflects the fact that mental health is no longer considered simply in the context of mental illness, is it? Promoting mental health is as important as dealing appropriately with incidents of mental illness. And the ACAS guide on promoting positive mental health at work defines mental health as emotional, psychological, and social well-being. And it notes that positive mental health is rarely an absolute, and factors inside and outside work will affect mental health, so that an individual will move up and down on a spectrum that ranges from good to poor. And it gives the example of somebody who may have generally positive mental health, but a relationship breakup triggers a period of depression, or somebody with a mental health condition such as anxiety, but who has developed good coping strategies. And so for most of the time they experience good mental health. Well, the support that is needed for both of those examples of employees is going to be quite different, but it may actually be the employee without a recognised mental illness that on occasion, on that particular occasion, is going to need more in-depth support. So ACAS guidance says it's going to be in an employer's interest to improve mental health awareness within the organisation, tackle the causes of work-related mental ill health, and create a workplace culture where people feel able to talk about their mental health, and then support staff who are experiencing mental ill health. Mental Health First Aid England has produced a report that revealed that 29% of the 2,000 employees they surveyed have never had a conversation with their line manager about their mental health. I mean, whether you say, well, that's great that 71% of people have or not, I don't know, but obviously there's a lot of people there who perhaps could be having helpful conversations who aren't. It'd be interesting to ask the line managers about whether or not they feel it's important to be proactive in that regard. So they've urged employers to do more to support staff, such as training for managers, regular wellbeing check-ins, and they've noted that the circumstances of the pandemic have led to discussions around mental health becoming much more relevant and much more common and accepted than before. Way back in 2017, a government-sponsored independent review of mental health and employers by Lord Stevenson and Paul Farmer, known as the Stevenson-Farmer Review, imaginatively, set out a 10-year vision for reducing the number of those leaving work with mental health problems. And it set out 6 mental health core standards that employers could implement across all workplaces, and importantly, can do so at little or no cost. So those are what I've set out there on the slide. So producing, implementing and communicating a mental health at work plan to promote good mental health for employees and outline support, develop mental health awareness by making information, tools and support accessible, encourage open conversations about mental health and the support available when people are struggling, have regular conversations with people throughout employment and the employment life cycle, provide good working conditions, and ensure there's a healthy work-life balance and opportunities for development, promote effective people management through line managers and supervisors. That's having regular conversations, as we say, with employees about how they are and being available and accessible to come to should there be concerns, and then monitor well-being in the workplace by talking to employees and identifying and understanding risk factors. So the Department of Health and Social Care has recently published a discussion paper and call for evidence on improving mental health and well-being, which includes the development of that 10-year plan. And it suggests that compassionate employers are needed, as Peter was saying, will protect and promote positive mental well-being by understanding and meeting physical and mental needs in the workplace. Yeah, so if we can move on to the next slide, please. So we've seen that mental health is an area where employers can do more to support their employees, but what are the potential downsides of not doing enough to support mental health on an individual basis? So from an employment law perspective, there are a number of possible claims that might arise. So a constructive dismissal occurs where an employee resigns in response to a fundamental breach of contract by their employer without first waiving or affirming the breach. A claim for constructive unfair dismissal can then be brought by an employee as long as that employee has 2 years service or more. So an employer has a duty to take reasonable care of the health and safety of its employees. That arises under statute, that's the Health and Safety at Work Act, but it's also an implied term of the employment contract. And the employer must also take reasonable steps to provide a safe workplace and a safe system of work. And an employer's health and safety duty extends to mental health as well as physical health. That's been established by case law way back when in the 1990s, so that's not a new concept at all. Short of constructive dismissal claims, of course, an employer will want to avoid internal grievances about managers not providing support, but where that employee has over 2 years service, there is the risk of a constructive unfair dismissal claim leading to compensation for lost earnings and other things being awarded. Stress at work claims, that's a personal injury claim, but a stress at work claim will arise where an employee can show that their employer has breached the duty of care owed to the employee. That's caused injury, and an injury of that type as a result of the breach was reasonably foreseeable. So claims can arise from bullying at work. In Green against DB Group Services UK Limited, the High Court found that Miss Green had been subjected to a relentless campaign of mean and spiteful behaviour designed to cause her distress, and that the behaviour amounted to a deliberate and concerted campaign of bullying within the ordinary meaning of that term. In the case of Gogay against Hertfordshire County Council, the Court of Appeal held that an employer's mishandling of a disciplinary procedure could give rise to a common law claim on the basis of negligence, as well as breaching the implied term of trust and confidence, and the implied term that all employers will take reasonable care for the safety of employees. There's also the potential where employees raise concerns for detriment and automatic unfair dismissal claims. So an example of a protected disclosure is a disclosure information which, in the reasonable belief of the worker making the disclosure, is made in the public interest and tends to show that the health or safety of any individual has been, is being, or is likely to be endangered. So there's a public interest element to the test, but there is in principle no reason why an employee raising concerns about their own health and safety would not, in their reasonable belief, be acting in the public interest. The classic example of that would be an airline pilot being compelled, complaining about being compelled to work too many hours, or an employee who's experiencing bullying in the workplace, given that there may be every chance and the bully could be targeting other people. The Employment Rights Act also provides protection for an employee who brought to their employer's attention by reasonable means circumstances connected with their work which they reasonably believed were harmful or potentially harmful to health or safety. There's no public interest element to that. And a work has the right not to be subjected to a detriment where they did either of those things, where they raised health and safety concerns or where they made a protected disclosure. And if an employee is dismissed because they've raised those concerns, then that will be an automatically unfair dismissal. Disability discrimination will be one that employers will certainly need to look out for. Now, let's set out the definition of disability first. A person has a disability if they have a physical or mental impairment, and the impairment has a substantial and long-term adverse effect on their ability to carry out normal day-to-day activities. Substantial means simply more than minor or trivial, and therefore amounts to a lower standard than what you might expect from the natural meaning of the word. The Equality and Human Rights Commission's guidance on the Equality Act sets out the following example of an effect which could be substantial, that's relevant in a mental health context. So the example is behaviour which challenges people around the person, making it difficult for the person to be accepted in public places. So a mental health condition won't have to cause somebody to, for example, stay in bed all day for it to amount to a disability. The bar is much lower than that. Usually an employer cannot be liable for disability discrimination unless it knew or should have known about the employee's disability, but that reference to should have known is important. Again, the Equality and Human Rights Commission guidance says it's not enough for the employer to show that they did not know that the disabled person had the disability. They must also show that they could not reasonably have been expected to know about it. So employers should consider whether a worker has a disability, even where one has not been formally disclosed. As, for example, not all workers who meet the definition of disability may think of themselves as a disabled person. And an employer must do all they can reasonably be expected to do to find out if a worker has a disability. And what is reasonable will depend on the circumstances, of course. And they remind employers that when making inquiries about disability, they should consider issues of dignity and privacy and ensure that personal information is dealt with confidentially. So potentially a really difficult line to draw there, a tightrope to walk, but it is not enough for a manager in an employment tribunal to say, yes, I noted that this employee was regularly in tears at their desk, but I didn't ask anything about it, so how was I supposed to know that they had depression? That's a fairly obvious example. There will be more subtle examples, but that concept of constructive knowledge is important, and liability cannot be avoided by simply not asking questions and making reasonable inquiries. The most obvious claims that will arise under disability discrimination are failure to make reasonable adjustments and discrimination because of something arising in consequence of disability. And in the context of that second claim, discrimination because of something arising in consequence of disability, the case of Grosset against City of York Council is an example of how careful an employer has to be when considering issues of disability. So the classic discrimination arising from disability situation is where an employee has been off on long-term sick and they're dismissed because they've been off on long-term sickness, but there will be other situations as well. Now, Mr. Grosset was a teacher and head of English at a school operated by the City of York Council. He suffered from cystic fibrosis, which was a disability, and as a consequence of his condition, he was required to spend up to 3 hours a day doing physical exercises to clear his lungs. Following a change of head teacher, his workload increased. Because of his condition, the claimant struggled to cope with the additional demands. He suffered stress, which in turn exacerbated his cystic fibrosis. He complained about unreasonable deadlines and workloads and mentioned his condition when requesting a reduction in work. However, his workload was not reduced. During the period, so this is the thing that he was ultimately dismissed for. During the period, the claimant took 2 lessons of 15 and 16-year-olds, over the course of which he showed an 18 rated film, Halloween. When the head teacher later discovered this, the claimant was suspended and eventually dismissed for gross misconduct. An employment tribunal held that he'd not been unfairly dismissed, as the council's decision was in the range of reasonable responses. Usually you'd expect a similar finding to follow in relation to a discrimination arising from disability claim. However, here, the tribunal considered that the claimant had suffered unlawful discrimination arising from disability. Although the council had made inquiries and the medical evidence available to them at the time of dismissal did not suggest a link between the misconduct and the disability, medical evidence available by the time of the tribunal hearing demonstrated otherwise. The council appealed, the Employment Appeal Tribunal dismissed that appeal. They said the tribunal was correct to find that the disability had caused or resulted in the act of misconduct. Now, clearly there were a few sort of causation steps along the line there, but it was a misjudgment that was had at its root cause the stress that was being exacerbated by cystic fibrosis and vice versa. The council knew there was a link between the misconduct and the disability. Knowledge was only relevant to whether or not the employer, knowledge was only relevant to whether or not the employer knew that the employee had the disability. Once it's been established that the employer knows about the condition, which they did here, the fact that there's a link to the conduct that results in the dismissal or warning or whatever it might be is going to be something for the tribunal to determine rather than the employer. So the employer's state of knowledge may be relevant when it comes to whether discriminatory treatment can be justified, but the problem for York Council there was that the school hadn't acted on the claimant's concerns about workload when he raised them, so that was always going to be difficult. If we can move on to the next slide, please. So what can we expect in the future? Well, the Mental Health and Income Commission has published a report revealing that the UK's current mental health income gap is £8,400. They found that 3 in 10 people with mental health problems experienced an income reduction during the pandemic. The Commission calls on employers and the government to introduce measures to reduce that gap. Now, these include the right to request flexible working for all employees, an increase in statutory sick pay, and a broadening of its eligibility criteria, as well as introducing a legal pay gap reporting requirement for large companies to reveal the inequalities and discrimination faced by employees with mental health problems, as the Commission puts it. Now, we already have gender pay gap reporting for employers with 250 employees or more. There has been a push for racial pay gap reporting to be mandated as well. So it's only relatively recently come up that there's been any calls for mental or physical health pay gap reporting. So whether that will ultimately see the light of day, I don't know. Obviously, there's a point at which businesses become overburdened by the need to report statistics. And that's before you even then consider the practical issues of businesses identifying which of its employees have mental health issues. Is that simply declared? Presumably, but as we've seen, it's not always the case that people with mental health conditions will regard themselves or declare themselves, even if they do, as disabled. The government on the 28th of July 2021 published its National Disability Strategy and announced that the Cabinet would consult on workforce reporting on disability for employers and publish a set of next steps. And they've said that alongside the consultation, the government will continue to raise awareness of the voluntary reporting framework, which does exist at the moment. So in the only part of Boris Johnson's job I intend to do for him, I will do that. So there is currently a voluntary reporting framework which provides support to employers to voluntarily report information on disability, mental health and well-being in the workplace. It's been developed by the government in partnership with large employers and partners to support organisations to record and report information on disability and mental health. It's aimed at large employers with over 250 employees, but can be used by smaller employers who are keen to drive greater transparency. The essence of the programme is that employers should provide a narrative to explain the activities in their organisation in relation to the recruitment and retention of disabled people, and report the percentage of individuals within their organisation who consider themselves to be disabled or have a long-term physical or mental health condition. The results of that were due to be published in February. On 25th of January, the High Court declared the strategy unlawful because of inadequate consultation, but it wasn't quashed, and the government has indicated its intention to appeal. Presumably it will move forward. There was also a separate consultation on disability workforce reporting launched on the 16th of December. That closing date has been pushed back to the was pushed back to the 8th of April of this year, and we're expecting a response anytime around now. That it aims to explore similar things about disability workforce reporting. The employment bill has disappeared. It was initially advanced in 2019. which is disappointing for people who support the furtherment of mental health support and so on. One of aspects of the employment bill that I believe in particular would help support mental health is the proposal to make flexible working a day one right, which is expressed to be in support of employee well-being. Now, there's already a flexible working procedure. Employees can make flexible working requests. In order for the statutory procedure to apply, they've got to have at least 26 weeks service. But the reality is anybody can ask the question about flexible working. You know, yes, there's a procedure. Yes, the government might change that so that it's a day one right rather than after 26 weeks. But you know, bear in mind that that can be requested by anyone now. But you know, obviously it supports somebody who's suffering from a mental health problem. So that might be where flexible working is requested on a temporary basis, but it can also prevent mental and physical health issues arising in the first place. The reality is that different people function better at different times. Different people prefer to work in the workplace as opposed to working at home for different proportions of the working week. You know, recognizing that science and adjusting working environments accordingly will keep people in work, enable people to find suitable employment, and enable people to be at their most productive and content. Also, a week's leave for unpaid carers was proposed, which will help people being run into the ground. It must also go alongside considerations of flexible working as well. And mental health policies and plans are becoming much more common. And I think particularly as organisations move towards home and hybrid working, having policies that promote mental health and communication in the workplace are going to become even more important. The Stevenson and Farmer Plan and ACAS recommend that these policies cover a commitment to promoting positive mental health, how the employer tends to identify and tackle the causes, how the employer is improving the physical environment to improve health, how the employer encourages and supports employees to engage in physical activity, staff networks or social action, and the support available. And all staff should, of course, be trained to understand mental health issues. And finally, from me, the importance of contacting and using occupational health can't be understated. You know, it may be, well, an employment tribunal isn't going to look favourably on an employer who has assumed the role of a medical expert. For example, where an employee is on sick leave, the employer is going to need advice on when they're likely to return and any adjustments that may be needed to enable them to do so successfully. In other cases, an employee may still be at work but require adjustments to enable them to remain at work. Occupational health or potentially another medical specialist are going to be the best place to make those decisions. That's all from me. I think I've got a next slide saying questions and then one with my face on it, but I think we're moving to the questions as sort of moderated by Sally, are we?
Absolutely. Thank you, David. Thank you, Peter. So much information. I've got a ton of questions all by myself, but unfortunately the attendees have got questions too, so we'll start there. I'm going to start with perhaps a fairly straightforward one for you, David. What are employers' responsibilities regarding annual leave allowances? Are they responsible in any way for ensuring employees do use their leave allowance through the year, or is the responsibility just on the employee's side?
Well, the strict sort of legal position in terms of the working time regulations is the liability will arise where an employer prevents an employee from taking their annual leave, and subject to what's in the employment contract about carrying over. If an employee hasn't taken all of their leave by the end of the leave year, then they lose it. But if it's certainly good practice to be monitoring employees' annual leave and encouraging them to take annual leave and their full annual leave entitlement. You know, if there were a and I'm employment law rather than personal injury, but if it were a personal injury claim and it had become apparent that the employer was aware that the employee was not taking any days off, perhaps even working long hours as well, and the employer hadn't done anything about that, then that isn't going to reflect too favourably on that particular employer. Does that answer the question? Yeah. I mean, there may be times an employer can compel an employee to take annual leave. Usually that's done in sort of factory shutdowns or Christmas office closures. It can be agreed between an employer and employee that they take annual leave whilst they're on sick leave. But yeah, that's probably going a bit broader than the question.
Thank you, David. One for Peter here. The attendee says, I like the graph describing both sides of a crisis and stress levels returning to old working practices. However, there doesn't seem to be much evidence that with the Back to the Office campaign from Whitehall for civil servants, for example, it understands this side of the curve. Is this something you are seeing in government? It's a bit of a hard question to ask somebody who works for government, but there you go, Peter.
Yeah. Obviously, there is a body of opinion that we need to have flexible working. I've always argued for flexible working. I don't think necessarily returning to the office means you're efficient. You might be just as efficient at home, more efficient at home, depending on the nature of your circumstances. So, yeah, obviously as a civil servant, I can't directly comment on what the government should do. Although certainly the science would suggest that we need to offer flexible working to all occupational groups. And I actually do think employees will lead the charge on this, not employers. The bank that told everyone to come back to the office, the one that was based in America, are now facing a crisis because their top performers in some cases are moving on because they said, I don't need to be in that, I don't need to physically be in the office. So I think you're going to be losing top performers who want more flexibility. So, but yeah, it's, I mean, that slide really does sort of chart how people's psychological reaction is to the change, but it can equally apply in the same way. That was a really good way of answering a question without actually answering it. There you go.
Well, you kind of answered it. And I think, 45,003 does emphasise the need for flexibility in individual situations to be taken into account. So I think there's a lot of support for what you've just been saying.
What I would add is that the narrative of work has changed. The way work is viewed and how we work is also changing. And remember this, that a tidal wave occurs because of two tectonic plates colliding. And that is the global pandemic and the global recession coming at the same time. So the old way of doing things may not necessarily, certainly will not apply in the same way. We will not be back into fully fitted out offices potentially for another 3 years. So we're looking at, before an open plan may not exist because there is now a waft of space in London for open plan, which they can't actually fill. So they're turning them into executive flats. So, yeah.
Thank you, Peter. We've got so many questions. I'm going to try and rush through a few of them. Apologies. So somebody has said here they'd be really interested in some kind of comment on the global legal landscape for mental health and well-being. Can you offer any insight into how UK legal requirements in this area compares with other parts of the world? I know you've got some insight, Peter. David, you may have too, but
no.
Go on, Dave.
No, I haven't, I'm afraid. So go on.
Okay. So when we define legal and we define regulation, like we need to sort of define it in a more clearer sense. Regulation is criminal law. Legal is often in this area determined by civil law, as David has spoken. So there are clear regulations across the globe that could be applied and are applied to looking at work-related stress. and the management of work-related stress and reduction of mental ill health at work. We all talk as regulators and have regulator forums, and if one takes a case, everybody else is on it to find out what you did and how you did it. So the legislation that exists in probably about 30-40% of the countries in the world could apply a formal structure. There's one European country that's issued 1,400 notices. So there's a will there. I'd love to be in that country. That was great fun. So the point is, it's globally there are regulations, and interestingly enough, Victoria's just passed legislation that requires psychosocial risk. I will be putting in legislation that requires a psychosocial risk assessment, which will cover all of the things that are in 45,003, including bullying and harassment. So yeah.
Thanks, Peter. And I do have a question directly for David here. Legal question, it says right at the start of it. When is it reasonable to move towards capability procedures? We've been supporting an employee who had a mental health crisis 2 years ago. There has been occupational health support, psychiatric support, wellness action plans, support from manager, HR. And the employee repeatedly confirms nothing at work is contributing to or exacerbating anxiety, but continues not to deliver work on time and to the standard expected and previously delivered. What's the legal position in this situation, David?
Yeah. So what was the first line of that? When is it reasonable to move to
Capability procedures?
capability?
So I guess
Right. Yeah. So well, first thing I'll say is that this is not advice. This is general information, and nothing you hear on a webinar such as this should be taken as advice. However, my contact details, I think, are there somewhere. So if you want to set up a file, I'd be more than happy to support. But yeah, I mean, in terms of when is it reasonable to move to something? I mean, the answer to that is unfortunately when it is reasonable. I mean, reasonable is a broad term, and the range of reasonable responses test that tribunals apply will apply to all stages of a procedure such as this. I would say that it is rarely going to be unreasonable for an employer to start managing somebody's performance. This sounds like, whilst the mental health issues are background and backdrop to it, essentially this is a performance procedure, performance management procedure. I mean, you described it as a capability procedure rather than ill health capability absence management. So you are at all times entitled to expect employees to perform their job to the required standard. Now, starting that process, and it sounds like you might have done that to an extent already, will involve telling the employee what needs to improve, giving them a reasonable time frame to improve, providing support where appropriate, and if that's the support for the mental health issues, then sounds like you've gone a long way to doing that already. And then presumably there's a policy in place, but follow that. But if not, then it'll be first warning, second warning, or final warning, and making the employee aware at all those stages of the consequences of them not improving following that review period. That review period will have to be reasonable. If this is an employee who's just passed the 2-year mark, then you're going to have to look out for unfair dismissal, but you're not going to be as expected to give them perhaps as long to improve as somebody who's perhaps been performing really well for 25 years and whose performance has suddenly dropped off a cliff. If they've got more than 2 years service, you've got an unfair dismissal claim to think about. If they haven't, and the root cause of this underperformance or this person has a disability and that has contributed to the underperformance in any way, then there's still going to be the potential for a disability discrimination claim. So you'll need to follow either the same or a very similar procedure as to what you'd need to follow if you were dealing with with an unfair dismissal claim of an employee perhaps just got over their 2-year service.
Thank you, David. We've only got 9 minutes left before we finish, so I'm going to I'm trying to bundle some of these questions together and ask for short answers, please. We've got several questions about employee surveys. Where can I find a good one? Are there any examples I can use? How far should they go? Can we ask about life outside of work to see how we want to support people? Peter, has the HSE got anything available, or do you know where there are some places that people can get some help?
We have the management standards questionnaire, which covers the 6 areas, and it's exclusively around work. My preference is always for smaller is better. So ours is 36 questions. I've seen 100 questions. I think it's too long. Just because you get more information doesn't necessarily mean it's good quality information. So you should, if you have an existing staff wellbeing survey, there's nothing to stop you adding questions about work-related practices such as the management standards to that. And if you go online and you were to search in work-related stress surveys, I think at last check it was 100,000 plus types of different surveys out there. But it's got to be short, it's got to be down to the ground. And with the general question, I'm trying to answer it quickly. You know, you can ask work home related questions, but it's interesting, isn't it? You know, what can you do to change the home? So your responsibility lies in the context of work and to manage whatever people bring in. Thank you.
Thank you. Many line managers are not comfortable having conversations about mental health and workloads, especially if someone claims they are mentally affected. What can organisations do to ensure managers are properly trained to handle such conversations? What structure should the organisation put forward? I don't know, which of you would like to take that?
Yeah, so competency frameworks for managers exist of how to, you know, so the management competencies for work-related stress. And really, the fact you feel uncomfortable talking to your employees, I get that, but you don't feel uncomfortable about talking to your family, your kids, or anyone else, or your mates. You've got to remember that the things that make you a good manager often is your ability that someone connects with you. So actually being open and being able to talk to people is important. I get that you feel uncomfortable, but I just don't understand today why we still switch off the emotional side of ourselves when we come into work and say we can't possibly reach out to people. But yeah, so that's kind of.
Yeah, absolutely. Oh, sorry, Peter.
You go for it, David.
Yeah, so I was just going to say, yeah, I mean, it's having those difficult conversations. They've got to be had, haven't they? And the analogy I always sort of draw is that, you know, if somebody's got spinach in their teeth after a meal, they probably want you to tell them about it. If somebody's coming into work and not performing, then they probably want you to approach them about it and support them to improve as a manager. Nobody wants to come into work. Well, the vast majority of people, there are some, but those are dealt with under a different procedure. But the vast majority of people come into work because they want to do well and they want to perform. So being supported to do that will be appreciated. So yeah, I think, you know, if you look at it from that perspective, it perhaps becomes a bit more straightforward.
And again, this is an area where 45003 has a lot of guidance and recommendations. It's worth having a look because there are recommendations in there about how to go about it. And just having better knowledge will help you as a manager have those conversations. We are human beings. If you remember Peter's picture about just reaching out to each other, we're just people. Let's talk to each other and that will help. Okay,
yeah, I think we've all got good examples of good line managers that tend to have these innate ability to get alongside us and make us feel actually that they're interested in our lives.
Absolutely. We only have 5 minutes left, people, which means we are not going to get all these questions. I really apologise for that. Quick one for David. Sometimes to make reasonable adjustments, there is one way of doing it can be to reduce workload, but that results in reducing the money they get. Is that legally fair?
Yeah, it can. Yeah, it can be. There is. It will depend on the circumstances, but yes, if you are reducing somebody's hours, then it will follow on that they are receiving less pay ordinarily. If you're just reducing their responsibilities but not reducing their hours, then maybe there'll be less pay because their job role moves down a grade. If you're requiring, if you're reducing the output but still requiring the same amount of time to be put in, well, that may be the adjustment. It's in itself. I mean, it may not be reasonable to then reduce pay. So it will depend on the circumstances, but in essence, there's no hard and fast rule that if you're making adjustments for somebody that results in a variation to their terms, that you have to protect their pay.
Thank you, David. And I'm going to finish with this rather general question. I kind of know what Peter will say, but I'm going to ask it. Is having an employee assistance program enough?
No. There you go. It's far too tertiary. And we know that it's like waiting for someone to lose 3 fingers before you actually put a guarding on a machine. It is the only health and safety issue where we wait till you're ill. We didn't wait for asbestos, we didn't wait for welding fumes, we didn't wait for scaffolding and etc. And we're not going to wait again to that's all we're doing in these stress risk assessments. We're putting a guarding between the person and the job. Now, the job is functionally wrong. It doesn't matter what EAP you've got, what level of mindfulness and resilience you've got, the environment isn't right. And that's what we covered in 45,003. The environment is actually really, really important.
So this is the moment where I plead with all our attendees, go and read the standard. It does help. It has got practical information. And also, please just take some action, do something. And look at the root causes, don't look at the individuals. It's not about all of us being stronger and sucking up more and more and more stress. It's about the organisation reducing that stress in the first place. So please go out and do something. Talk to each other, listen to each other, and take some action. Even if it's not perfect, take some action. Any final thoughts? Go on, Peter.
But no, I just really to encourage people that, we don't have time to wait anymore. This really is the dawn of a new age of working, and work-related stress and mental health is the new occupational health crisis. It is the new, we did it, we intervened in asbestos as we will intervene in this area. And unfortunately, I have to go because I've got another meeting in 1 minute. Welcome to the new world.
Thank you very much, Peter. Any last thoughts, David, before we close?
No, just thank you to everyone for attending. Thank you to Sally and Peter as well.
Brilliant. Well, thank you for your insights. It's been absolutely fascinating. Please save the date, 7th of September. We're going to have a full day of webinars on all sorts of topics. And if there's anything in particular you want us to cover, let us know, because we haven't fixed the agenda yet. But do join us on the 7th of September. We're going to get really good speakers in. We're going to cover all sorts of things. Thanks very much. I look forward to seeing you again soon.